Good evening, everyone. Welcome to our LAMP CAA assessment. We are now on week 3 rather, and we shall continue with musculoskeletal system part 2 and the Luo. We'll discuss the Luo connecting points. So let's call on Ma'am Ami Glorioso. Good evening.
Okay. Good evening, Doc. Good evening, classmate.
Okay, let's start.
Number 19
pointing to what?
is pointing to abductor pollicis longus.
Okay. The biceps brachii is indicated by number?
Number 1.
Good. Number 12 is pointing to?
Extensor carpi ulnaris.
8. The flexor carpi radialis is indicated by number?
7.
Number 11 is pointing to?
Flexor carpi ulnaris.
Number 18 is pointing to?
Extensor carpi radialis brevis.
The brachialis is indicated by number?
2.
Number 16 is pointing to?
Brachioradialis.
Brachioradialis. Number 14 is pointing to?
Extensor digitorum.
The flexor pollicis longus is indicated by number?
5.
The brachioradialis is indicated by number?
3.
Number 15 is pointing to?
Tricep.
Okay. The flexor digitorum superficialis is indicated by number?
4.
Number 13 is pointing to?
Extensor digit minimi.
The pronator teres is indicated by number?
6.
The palmaris longus is indicated by number?
8.
Number 10 is pointing to?
Unconus.
The flexor carpi ulnaris is indicated by number?
9.
Number 4 is pointing to?
Flexor digitorum superficialis.
The extensor digitorum is indicated by number?
Number 4.
14. Number 14 is number 4. Number 17 is pointing to?
Extensor carpi radialis longus.
The extensor carpi radialis brevis is indicated by number?
Number 18. Number 18.
Number 1 is pointing to?
Maybe I have exam.
Bicep.
I finish at 8:30.
5.
No, not now. I'm in class. I have exam.
Number 2 is pointing to?
Brachialis.
The extensor carpi radialis longus is indicated by number?
17.
Brachioradialis is indicated by number?
16.
Number 3 is pointing to?
Brachioradialis.
The triceps brachii is indicated by number?
15.
The extensor digiti minimi is indicated by number?
13.
Number 5 is pointing to?
Flexor pollicis longus.
Number 6 is pointing to?
Pronator teres.
The extensor digiti minimi is indicated by number?
Extensor digi minimi.
Number what?
Number 1. Number 13.
Number 7 is pointing to?
Flexor carpi radialis.
Number 8 is pointing to?
Palmaris longus.
The extensor carpi ulnaris is indicated by number?
Saan na po tayo, Doc? Number 8.
There's no number 8. Number
8 na po ba? Number 8 is palmaris longus, Doc.
No. What number is the extensor carpi ulnaris here?
Number 12, Doc.
Okay. Flexor carpi ulnaris is indicated by number?
11.
11. The anconius is indicated by number?
10.
The abductor pollicis longus is indicated by number?
19.
Number 9 is pointing to?
Flexor carpi ulnaris.
Number 18 is pointing to?
Extensor carpi radialis brevis.
The brachialis is indicated by number what?
2.
Number 16 is pointing to?
Brachioradialis.
Number 3 is pointing to?
Brachioradialis.
Now, brachioradialis is indicated by number.
16.
The triceps brachii is indicated by number.
15.
Congratulations, Ma'am Ami.
Thank you, Doc.
So we will not. No mistake. Perfect. Good. Now let's call on Sir Darwin Misola. Good evening, Sir Darwin. Let's start. The origin of the biceps brachii is
coracoid process of the scapula and supraglenoid.
the insertion of the extensor carpi ulnaris is
Base of the fifth metacarpal.
the radial tuberosity and bicipital aponeurosis into the deep fascia on the middle part of the forearm form the insertion of which muscle?
Biceps brachii.
What is the insertion of the brachioradialis?
Distal styloid process of the radius.
The lateral supracondylar ridge of the humerus is the origin of what muscle?
Brachioradialis.
The origin of the extensor carpi ulnaris is the
Lateral epicondyle of the humerus. Posterior border of ulna.
the infraglenoid tubercle of the scapula and the dorsal surface of the humerus. Origin of the
Triceps brachii.
The origin of the extensor digitorum is the
Lateral epicondyle of the humerus.
middle and distal phalanges of the second to fifth fingers form the insertion of the
Extensor digitorum.
The insertion of the flexor carpi radialis is
Base of the second and third metacarpals.
the middle of the volar surface of the radius and the adjacent interosseous membrane form the origin of which muscle?
Flexor pollicis longus.
The origin of the palmaris longus is
Medial epicondyle of the humerus.
what is the insertion of the flexor pollicis longus?
Base of the distal phalanx of the thumb.
Insertion of the palmaris longus.
Palmar aponeurosis.
What is the insertion of the triceps brachii?
Wala ka na ng process of the ulna.
What is the origin of the abductor pollicis longus?
Ulna radius, intercostal
Interosseous membrane.
membrane.
The lateral supracondylar ridge of the uterus is
Extensor carpi radialis longus.
insertion of the abductor pollicis longus is
Base of the first metacarpal.
what is the origin of the anconeus?
Lateral epicondyle of the humerus.
The lateral surface of the olecranon and the distal posterior ulna form the insertion of which muscle?
Anconeus.
The origin of the extensor carpi radialis brevis is
Humerus of the anterior of lateral epicondyle.
what is the insertion of the brachialis?
Coronoid process and the tuberosity of the ulna.
What is the insertion of the extensor carpi radialis brevis?
Posterior base of the third metacarpal.
The insertion of the flexor carpi ulnaris is
The pisiform.
what is the origin of the brachialis?
Anterior surface of the humerus, especially the distal half.
The origin of the extensor digiti minimi is
Anterior portion of the lateral epicondyle of the humerus.
what is the insertion of the flexor digitorum profundus?
Base of the distal phalanges of the fingers.
What is the origin of the flexor carpi ulnaris?
Medial epicondyle.
The dorsal base of the proximal phalanx of digit 5, the extensor expansion, is the insertion of what muscle?
Extensor digiti minimi.
The upper surfaces of the ulna and the interosseous membrane and deep fascia of the forearm form the origin of which muscle?
Flexor digitorum profundus.
The action of the abductor pollicis longus is to abduct the thumb.
True.
The action of the anconeus is to
Support elbow joint and assist in extension.
the elbow joint is supported and assisted in its extension by the action of what muscle?
Anconeus.
Action of the anconeus is to flex the elbow and supinate the forearm. True or false?
False.
The main actions of the biceps brachii are to flex the elbow and supinate the forearm.
True.
The main actions of the biceps brachii are
Flex elbow and supine forearms.
supinate the forearm. Elbow is flexed by the action of what muscle?
Biceps brachii.
Action of the brachialis is to abduct the thumb. True or false?
False.
Action of the brachialis is to what?
Flex at elbow joint.
Flexion of the elbow is assisted by the action of the
Brachialis.
action of the extensor digitorum is to extend the forearm. True or false?
False.
So what does it do?
4 medial digits yung
Finger extension. Kaya extension, extensor digit fingers. Okay. Action of the brachioradialis is
flex the forearm and elbow joint.
elbow is flexed by the action of the
Brachialis.
action of the flexor carpi radialis is to flex and abduct the wrist. True or false?
True.
Action of the flexor carpi ulnaris is to flex the thumb. True or false?
False.
Okay. Congratulations, Sir Darwin. Very good. Let's call on Ma'am Angel po. Okay, Ma'am Angel.
Good evening, Doc. Good evening, classmates.
The hand is extended and abducted by the action of what muscle?
The extensor carpi radialis brevis.
Action of the brachioradialis is to flex the forearm at the elbow. True or false?
True po, Doc.
The main action of the triceps brachii is?
To extend the forearm.
Anong difference niya sa biceps brachii?
Yung biceps po kasi brachii is sa bicep nag-aano po siya.
No,
Nag-extend siya.
biceps?
Triceps brachii po nasa
Ang triceps nag-extend. Ano ginagawa ni biceps brachii? Pareho silang apelyido.
po. Nag-aano po, Doc.
Flex.
Ang tawag po, flex po.
Okay. The forearm is extended by the action of what?
Triceps brachii po.
Action of the extensor carpi radialis brevis is to extend the forearm. True or false?
False po, Doc.
So what does it do?
Ano po, flex po, Doc.
It extends the hand, not the forearm.
Okay po.
The action of the extensor carpi radialis brevis is to?
Extend and abduct the hand at the wrist joint.
The hand is extended and abducted by the action of?
The extensor carpi ulnaris.
The action of the extensor carpi radialis longus is to extend and abduct the hand at the wrist joint. True or false?
True po, Doc.
Action of the extensor carpi radialis longus is to?
Extend and abduct the hand at the wrist joint.
Good. Fingers are flexed by the action of blank.
The flexor digitorum superficialis.
Action of the extensor carpi ulnaris is to extend the little finger. True or false?
False po, Doc.
So anong action niya? And remember, the name is extensor carpi ulnaris. So
Extend the
hand.
yes, Doc.
Yes, alam mo yan. Okay. Action of the extensor carpi ulnaris is?
To extend and abduct the hand at the wrist joint.
Yes, extend and
Apo.
abduct. Okay. Hand is extended and abducted by the action of?
The extensor carpi radialis longus.
Good. Action of the flexor digitorum superficialis is to flex the fingers. True or false?
True po, Doc.
Thumb is flexed by the action of what muscle?
The flexor pollicis longus.
Okay, so pollicis is thumb. Okay. Wrist is flexed and abducted by the action of?
Flexor carpi radialis.
Good. Action of the flexor carpi radialis is?
To flex and abduct the wrist.
Thumb is abducted by the action of?
The abductor pollicis longus.
The action of the extensor digiti minimi to extend the little finger. True or false?
True po, Doc.
Alam nyo na, digiti minimi. Minimi. Little. Action of the flexor carpi ulnaris is?
To flex and abduct the wrist.
Okay. Wrist is flexed and abducted by the action of?
Flexor carpi ulnaris.
Action of the palmaris longus is?
To flex the wrist.
Hand, wrist, and fingers are extended by what muscle?
The extensor digitorum.
Action of the flexor carpi ulnaris is to flex the thumb. True or false?
False po, Doc.
What does it flex?
Yung
Ulnaris.
carpi ulnaris is the ulnar. Opo, the little,
It flexes
uh,
yung wrist ang piniflex niya.
Yes.
opo,
Action of the abductor pollicis longus is to?
abduct the thumb.
Very good. Little finger is extended by the action of the?
Extensor digiti minimi.
Okay. Action of the triceps brachii is to flex the forearm. True or false?
False po, Doc.
So what does it do?
Extend po, Doc.
Extend. Very good.
False po, Doc.
Action of the flexor pollicis longus is to?
Flex the thumb.
Good. Wrist is flexed by the action of the?
Palmaris longus.
The action of the palmaris longus is to flex the wrist. True or false?
True po, Doc.
Congratulations, Ma'am Angel. Good job.
Thank you, Doc.
Very good. Let's call on Sir June Azariel. You look so prepared. Let's start. Action of the extensor digitorum is?
Sorry po. To extend the hand, wrist, and finger.
Okay. The hand, wrist, and fingers are extended by what muscle?
Extensor digitorum.
The action of the flexor digitorum superficialis is to flex the fingers. True or false?
True.
Action of the extensor digiti minimi is?
Extend the little finger po.
The little finger is extended by?
Extensor digiti minimi.
Okay. Action of the flexor pollicis longus is to flex and adduct the wrist. True or false?
False, false po.
Okay. Anong action niya? Remember, flexor siya. Sinong finiflex niya?
The action of the flexor pollicis longus is primarily to flex the thumb, not the wrist.
The thumb, because of pollicis. Gets yun na? Kaya may ano siya, may pangalan siya. Pollicis is thumb. Good. Action of the flexor digitorum superficialis is to?
Flex the fingers.
Fingers are flexed by?
Flexor digitorum superficialis.
Action of the flexor carpi radialis is to flex and abduct the wrist. True or false?
True po.
Action of the flexor pollicis longus. Remember, pollicis is?
To flex the thumb po.
Good. The thumb is flexed. Paulit-ulit. Okay. Is flexed. Okay. By the action of?
Flexor pollicis longus.
The action of the flexor carpi radialis is to?
To flex and abduct the wrist. Po.
Flexion of the elbow is assisted by the action of?
Brachialis.
Brachialis. Action of the extensor digitorum is to extend the forearm. True or false?
False po.
You know,
The primary action of the extensor digitorum is to extend the finger, hand, and
Extend
wrist,
the
not the forearm.
Okay, very good. Main action of the triceps brachii.
Extend the forearm po.
Good. Number 17 is pointing to what muscle?
Flexor digitorum longus.
Yeah, tensor fasciae latae is indicated by number?
1.
Number 9 is pointing to what muscle?
Fibularis tertius.
Yes. Number 16 is pointing to?
Soleus.
Sartorius is indicated by number?
2.
Number 15 is pointing to?
Gastrocnemius.
Okay. Rectus femoris is indicated by number?
3.
Number 14 is pointing to?
Vastus medialis.
Extensor digitorum longus is indicated by number?
8.
The iliotibial tract is indicated by number?
4.
Number 13 is pointing to what muscle?
Abductor magnus.
The vastus lateralis is indicated by number?
5.
Number 12 is pointing to the
Gracialis.
gracilis. Fibularis longus is indicated by what number?
6.
Number 10 is pointing to
Pectonius.
actinius.
Pectinius.
Number 11 is pointing to
Abductor longus.
The tibialis anterior is indicated by number.
7.
Tibularis tertius is indicated by number.
9.
The flexor digitorum longus is indicated by number.
17.
Number 1 is pointing to.
Flexor acuminati. Ano ba ito?
Number 8 is pointing to.
Extensor digitorum longus.
The pectineus is indicated by number.
10.
Number 7 is pointing to.
Tibialis anterior.
Adductor longus is indicated by number.
11.
The soleus is indicated by number.
16.
What? Yeah, 16.
16. Opo.
Yeah.
Opo.
Number 6 is pointing to.
Tibularis longus.
Gracilis is indicated by number.
12.
Number 5 is pointing to.
Vastus lateralis.
The adductor magnus is indicated by number.
13.
Number 4 is pointing to.
Electrobial tract.
Number 2 is pointing to.
Sartorius.
The vastus medialis is indicated by number.
14.
Number 3 is pointing to.
Rectus femoris.
Now, gastrocnemius is indicated by number.
15.
Wow, congratulations, Sir June. Na-redeem mo talaga
Oh,
si
makatulog na ako.
congratulations. See, you can do it, no? You just have to believe you can do it.
Makatulog na ako.
Sure, you are with us, so you must be good. Okay?
Thank you, Doc.
Congratulations. So, ano pa? Mag-effort na tayo. You have to level up, You have to be better than your previous self. Okay. Let's call on Ma'am Lane Arandia. Good evening.
Hello, good evening.
Okay. Adductor magnus is indicated by what number?
Number 18.
Good. Number 32 is pointing to what muscle?
Femoralis brevis.
Gluteus medius is indicated by number.
Number 25.
Gracilis is indicated by number.
22.
No.
Ay,
One mistake. Nakamarka yan.
Number 19 po pala, Doc.
Okay. Don't commit a mistake next time. It's going to. Okay. Number 31 is pointing to
Femoralis longus.
semitendinosus. The semitendinosus is indicated by number.
Number 20.
Number 26 is pointing to.
Gluteus maximus.
Number 30 is pointing to.
Gastrocnemius.
No.
Number 30.
Two mistakes.
Ay,
The soleus.
Femoralis
Inano yan?
solgus.
Oh, no. You're not listening kanina. Definitely hindi siya gastrocnemius. So kung hindi vipularis longus, so it must be the. Okay. I want
Solgus
to read up on that. The semimembranosus is indicated by number.
27.
No.
Ala.
What happened? Three mistakes.
21 po, Doc.
Is that a guess or you really did you read up on this? Ito pwede walang reference. Okay, number 29 is what muscle?
Semitendinosus. Mali pa rin.
So mali.
Ano po siya? Vastus lateralis.
You have 4 mistakes. Sartorius. No number.
19.
No.
Ay, mali pa.
No.
Ano ba
5
to?
mistakes.
Mamadali kasi ako, Doc.
Ay, kailan mo ito ginawa? Dapat last week pa. Okay. What's your answer?
Teka lang. Sartorius. Number. Ano ba yun? 22.
Okay. Flexor digitorum longus is what number?
Flexor. 31.
Oh, 6 mistakes. Flexor digitorum longus.
Sana pa.
Okay. What's your answer?
30,
No.
24,
So mali ang 32, mali ang 31, so it's 24.
24.
Okay. Number 28 is what muscle?
Biceps femoris.
Gastrocnemius is indicated by number.
23.
Number 27.
Iliotibial tract.
It's so obvious kasi maputi siya, oh. Next. Let's go to, okay, number 25.
Gluteus medius.
Gluteus maximus. It's what number?
26.
Number 18 is pointing to.
Adductor magnus.
Number 24.
Femoralis longus.
No.
Ay, mali. Extensor. Ano ba yung sinabi?
No, mali din. Parehong mali.
Lip-
Oh, flexor digitorum longus. Okay, you have 7 mistakes so far. Iliotibial tract.
27.
Number 23. Anong muscle yan, 23?
Sartorius.
Oh,
Ay, mali. Gastrocnemius pala.
okay. Remember that. Hawakan mo ni gastrocnemius mo. Fibularis brevis. What number?
32.
Biceps femoris. Remember, this is femoris.
28.
Okay. Number 22.
22. Isum semembroid. Ay.
Wrong.
Sartorius po yan.
Okay. Sartorius. Vastus lateralis.
Vastus 29.
Number 19.
Gracilis.
Number 21.
21. Semimembranous.
Membranosus. Soleus. Nasaan ang soleus dyan?
30.
B0. Number 20. Anong muscle yan?
Semitendinosus.
Ang fibularis longus. Anong number?
31.
Okay. What is the action of the tensor fascia lata?
Helps stabilize the hip and knee joints.
The action of the gastrocnemius.
Plantar flex the ankle and flex the knee.
Okay. Aside from flexing the knee, the sartorius also what?
Flexes and laterally rotates the hip joint.
Okay. Action of the soleus.
Plantar flex the ankle.
Action of the rectus femoris.
Extend the knee.
Action of the flexor digitorum longus.
Flex 2 to 5 and help in plantar flexion.
Okay. Action of the adductor longus.
Adduct and flex the thigh.
Action of the vastus lateralis.
Extend the knee.
As well as being a powerful thigh adductor, the adductor magnus assists with what?
Extension of the knee and medial rotation of the
No. Wrong.
Flexion and medial extension of
No.
the knee.
Powerful thigh adductor. The answer is flexion, extension, and lateral rotation of the thigh. Okay. Action of the fibularis or peron. Okay, there are two names. The new name is fibularis longus. It used to be known as peroneus longus. Okay, what's the action?
Ebert and plantar flex of
The foot.
Ebert and plantar flex the foot.
Action of the tibialis anterior.
Dorsiflex the ankle and invert the foot.
Action of the gracilis.
Flex the knee and adduct the thigh.
Action of the extensor digitorum longus.
Extend toes 2 to 5 and flex the ankle.
Action of the pectineus.
Adducts the thigh and flexes the hip joint.
Action of the vastus medialis.
Extend the knee.
As well as being a powerful thigh adductor, the adductor magnus assists with.
Extension of the knee and medial
No.
rotation.
This is an repeat, di ba? Flexion, extension, and lateral rotation of the thigh. Action of the fibularis or peroneus brevis.
Invert and plantar flex the foot.
Action of the vastus lateralis.
Extend the knee.
Action of the soleus.
Action of the soleus. Plantar flex the ankle.
Action of the gracilis.
Medially rotate the thigh.
No.
Medially adduct. Flex
Flex the knee.
the knee
Adduct
and
the-
adduct the thigh.
as well as medially rotating the tibia, the semimembranosus what?
Flexes the thigh and extend
No.
the knee.
Extends the thigh, flexes the knee. As well as flexing the knee, the sartorius also.
Flexes and laterally rotates the hip joint.
The action of the gastrocnemius.
Plantar flex the ankle and flex the knee.
Action of the fibularis or peroneus longus.
Everts and plantar flex the foot.
Action of the flexor digitorum longus.
Flex toes 2 to 5 and help in plantar flexion.
As well as assisting with rotation of the thigh, the action of the gluteus medius is
Abduct the thigh.
abduct, okay?
Abduct is one.
AB, boy. Action of the gluteus maximus.
Extend the hip joint.
Action of the biceps femoris.
Extend the knee and laterally extend.
This is biceps. Biceps yan.
Biceps. Extend the
No,
extend
hindi siya
the
nag-extend.
flex the knee.
Flexes
And
the knee,
rotate
rotates the tibia laterally. As well as medially rotating the tibia, the semitendinosus. What?
Extend the thigh and flexes the knee.
The action of the vastus intermedius is
Action of vastus intermedius. With extends the knee.
okay. You need to exert more effort, ha? Kailan ba kayo nag-aral, Ma'am Lane?
Actually, nung ano po lang, Dok. Nung Monday, pero
This Monday?
ano po kasi, opo, this Monday.
Oh,
Pero
next-
ano kasi po tawag dito, hindi siya tuloy-tuloy, kaya parang yung time,
okay.
masyadong namamadali po. So,
Time management po, importante, ha? So, right after this, you have to start answering week 4. Okay. Sige. Well, I hope you can do yourself next time. 8 mistakes. Actually 9. Okay. Okay. Try harder next time. Don't be disappointed. It's okay. Okay, thank you very much, Ma'am Lane.
thank you po.
Sir Elvis, are you ready? Sir Elvis?
Yes, Doc.
Okay. Action of the abductor brevis.
Abduct and flexion of the thigh.
Action of the flexor hallucis longus.
Flex toes 2 to 5 and plantar flex the foot.
Tingnan nyo, hallucis to, ha? Hallucis is toe. Ang pollicis is thumb. This is hallucis. So, can you change your answer?
Sorry, Doc.
What's your answer? Sa name pa lang, tingnan nyo mabuti yung name. Do not be misled by ang ginagawa niyan, hindi yan flexion, that's extension. Pero ang ano kasi natin, okay, flexor hallucis longus. Hallucis is great toe, hallux. Remember? So what, can you change your answer?
Abduct and everts the foot.
No. Flex the great toe
That's a great two and also sa panid ankle.
or hallucis. Huh? Yan na yung clue. So that is why sa week 4, meron tayong mga ano to, like where we get yung mga tinatawag na mga root word, okay? You need to master that, memorize that. So the answer should be flex the great toe and help to supinate the ankle. Number 3, the main action of the lumbricals of the foot.
Toes of the foot. Extend the toes of the entire phalangeal joints.
Okay. Action of the psoas major.
Flex and laterally rotate the hip.
Good. Action of the gluteus minimus.
Flex the hip.
No. Extend the hip. Extend. Action of the iliopsoas.
Flex the torso and thigh.
Action of the inferior gemellus.
Rotate the thigh laterally.
Action of the obturator externus.
Rotate laterally and help to adduct the thigh.
Main action of the interossi or the dorsal aspect is
Abduct the second, third, and fourth toes.
main action of the interossi or the plantar aspect.
Adduct the third, fourth, and fifth tooth.
Action of the obturator internus.
Rotate laterally and help to abduct the thigh.
Action of the peroneus tertius.
Dorsiflex, invert, and up the foot.
Action of the gemellus superior.
Laterally rotate and stabilize the hip.
Action of the iliacus.
Medially flex and rotate the hip.
Main action of the flexor digitorum brevis.
Flex the lateral four toes.
Main action of the flexor hallucis brevis. Take note, hallucis na naman, oh. Hallucis. So what's your answer here?
Flex the metatarsophalangeal joints of the big toe.
Good. Main action of the piriformis.
Laterally rotate the hip joint.
Action of the plantaris.
Plantar flex the ankle and flex the knee,
Action of the popliteus.
which is assist extension of the knee joint.
Oh. Another try. Pili ka lang, medially rotate or laterally rotate the tibia. Analyze very well the... Kita nyo naman yan, no? Yung ginagawa niya, medially rotate the tibia or laterally rotate the tibia.
Laterally rotate the tibia.
Medially rotate. Okay. Alam ko medyo na. As well as helping to adduct the hip, the quadratus femoris. What?
The hip laterally.
Very
Laterally.
The main action of the extensor hallucis longus.
Extend the toes.
No.
Extend the big toe and foot.
Yeah. Hallucis di ba? Hallucis, big toe. Huwag mong kalimutan. Basta hallux. Hallucis. Action of the abductor hallucis. So isa lang may big toe dyan.
Flex and abduct the big toe.
Okay, good. Action of the flexor digiti minimi brevis in the foot.
Flex the metatarsophalangeal joint of the little toe.
Okay. Action of the posterior gemellus.
Rotate the thigh laterally and help abduct that thigh.
As well as inverting the foot, the tibialis posterior also.
Adduct the foot and plantar flex the ankle.
Action of the articularis genu is
Retract the bursa of the knee as the knee extends.
Action of the extensor hallucis brevis. So hanapin, okay.
Grade 2.
Extend the great toe, okay. Main function of the tibialis posterior.
Invert the foot.
Action of the abductor digiti minimi.
Flexion abduct the big 2.
Action of the adductor hallucis.
Flexion abduct the big 2.
The gluteal tuberosity of the femur and the iliotibial tract form the insertion of which muscle?
Gluteus maximus.
Origin of the adductor longus.
Pubic body just below the pubic crest.
Insertion of the rectus femoris.
Posterior tendon as one of the 4 quadricep muscles.
Insertion of the adductor longus.
Middle third of the linea aspera.
What is the origin of the tensor fasciolate?
Iliac crest.
Plantar surface and base of the distal phalanges of the 4 lesser toes describes insertion of what muscle?
Flexor digitorum longus.
Tuberosity of the ischium, the linea aspera, and the femur form the origin of which muscle?
Bicep femoris.
What is the insertion of the tensor fasciolate?
The iliotibial tract.
What is the insertion of the biceps femoris?
The lateral side of the fibula and the tibial condyle.
Origin of the tibialis anterior.
Body of tibia.
What is the origin of the gastrocnemius?
The lateral and medial condyle of the femur.
The insertion of the tibialis anterior.
Medial cuneiform and the first metatarsal bone.
Insertion of the gastrocnemius.
Endo and mid posterior calcaneus.
What is the origin of the flexor digitorum longus?
The posterior surface of the body of the tibia.
The gluteal surface of the ilium, the lumbar fascia, and the sacrum form the origin of what
Gluteus
muscle?
maximus.
Okay, congratulations, Sir Elvis. Do not feel disappointed. You had 2 mistakes.
Yes, Doctor.
Okay lang yon. Nakakamali din tayo. But again, you always should review your work, okay? Saka be wary of all the root words, okay? Yeah. Doon mo makikita na kaagad. Thank you very much. Now let's go to Baguio. Let's call on Ma'am Janine Chua.
Hello, Can.
Ma'am Janine Chan, I'm sorry.
Go.
Nahihilo na ako sa dami ng muscle. I'm sorry. So I hope you can get a perfect score. I'm sure you can. How go, Ma'am Janine? Lateral condyle of the tibia, shaft of the fibula, and the interosseous membrane form the origin of which muscle?
The extensor digitorum longus.
What is the insertion of the gracilis?
The tibia.
Dorsal surface and middle and distal phalanges of the lateral 4 digits are insertions of
The extensor digitorum longus.
origin of the sartorius.
Inferior to the anterior superior iliac spine.
What is the origin of the fibularis longus?
The upper lateral shaft of a fibula.
What is the other name of fibularis longus? Erroneous longus. Okay. Insertion of the sartorius.
Anteromedial surface of the upper tibia in the pes anserinus.
What is the insertion of the fibularis longus?
First metatarsal and the medial cuneiform.
What is the origin of the semimembranosus?
The ischial tuberosity.
The patella via the quadriceps tendon and the tibial tuberosity via the patellar ligament form the insertion of
Vastus lateralis.
origin of the flexor digitorum longus.
Posterior surface of the body of the tibia.
What is the insertion of the semimembranosus?
The medial surface of the tibia.
The plantar surface and base of the distal phalanges of the 4 lesser toes forms the insertion of which muscle?
The flexor digitorum longus.
The greater trochanter, intertrochanter recline, and the linea aspera of the femur form the origin of?
Adductor magnus.
No.
No?
Vastus
Vastus lateralis.
One mistake.
Wait lang. One mistake. Wait lang.
What is the origin of the gracilis?
The ischopubic ramus.
Fibula and middle border of the tibia at the soleal line forms the origin of what muscle?
soleus, soleus.
Full tuberosity at the base of the fifth metatarsal bone forms the insertion of which muscle?
Fibularis brevis,
The origin of the semitendinosus is
tuberosity of the ischium,
ischium.
ischium,
What is the insertion of the pectineus?
the pectineal line of the femur,
Origin of the fibularis longus.
upper lateral shaft of the fibula,
Insertion of the semitendinosus.
the tibia, pes anserinus,
Origin of the pectineus.
pectineal line of the pubic bone,
What is the insertion of the fibularis longus?
the first metatarsal and the medial cuneiform,
Fibulum in medial border of the tibia at the soleal line forms the origin of what muscle?
soleus,
What is the
soleus,
origin of the fibularis tertius?
the distal anterior surface of the fibula,
What is the insertion of the soleus?
the tendocalcaneus,
Insertion of the fibularis tertius.
dorsal surface of the fifth metatarsal,
What is the origin of the vastus medialis?
the middle side of the femur,
The gluteal surface of the ilium under the gluteus maximus forms the origin of
gluteus medius,
insertion of the vastus medialis.
quadriceps tendon,
Insertion of the gluteus medius.
greater trochanter of the femur,
Number 9 is pointing to
perimecium,
a muscle's elasticity, its ability to
return to its original length after contraction,
what does number 6 indicate?
a tendon,
An adductor is a skeletal muscle which
moves a limb towards the midline.
what does number 8 indicate?
8, the fascicle.
Which number indicates an example of cardiac muscle?
This I'm not sure. 12,
Good. Which type of muscle is stimulated by nerve impulses from the brain and spinal cord?
skeletal.
Which number indicates the main skeletal muscle?
2,
Skeletal muscle is attached to bones by
tendon.
which number indicates an example of skeletal muscle?
10,
Where on the body would you find the trapezius?
the back.
The muscle around the eyes is called
Orbicularis oculi.
main muscle involved with chewing.
Master.
How many main types of muscle tissue are there?
Ayun. 3,
Which type of muscle is also known as voluntary muscle?
skeletal.
Congratulations, Mom Janine.
Sure yun to.
I feel disappointed you had one mistake, but it's okay.
Thank you, Doc.
Next time, don't commit a mistake. Okay, thank you very much. Now let's call on Mom Joy. Angelina. Mom Joy, good evening. Can you show your face? Are you ready? Mom Joy, are you there? Where is Mom Joy? Nawala. Okay, I will just call on... Okay, Ma'am Lynn, are you okay? Ma'am Lynn? Ma'am Lynn, good evening. Okay. Okay, oh, Ma'am Fe, would you like to try? Ma'am Fe Santos? Let's wait. Bakit nawal? Okay, Ma'am Lynn Galarita, can I? Hello? Okay. Ano ba yan? Okay. Can I call on Sir June Azariel again? Sir June? Next time, please be present, okay? Sir June, are you there? Ma'am Ami?
Yes po, Doc.
Okay, can you help out?
Okay, Doc.
Okay. Number 11 is pointing to an image of
Smooth muscle.
the periosteum is indicated by number.
Number 1.
Which number indicates the epimysium?
Number 3.
A muscle fiber is indicated by number.
Number 4.
What is the name of the large muscle at the back of the calf?
Gastrocnemius.
Gastrocnemius. Okay. Which of the following muscles turns the head?
Sternocleidomastoid.
A muscle's contractility is its ability to.
Contract forcefully when stimulated.
What does number 5 indicate?
Myofibril.
Which of the following muscles acts as an antagonist to the biceps brachii?
Tricep brachii.
Biceps brachii. Okay. Which type of muscle is sometimes called involuntary muscle?
Smooth.
Why is it called an involuntary muscle?
Involuntary muscle.
Mm-mm.
Smooth.
Bakit po siya involuntary ang tawag?
Involuntary muscle, Doc. Kasi po gumagalaw.
Anong difference niya sa voluntary muscle?
Voluntary muscle, Doc, is stress structure.
Can you control an involuntary muscle? Can you make it stop?
Yes, Doc.
No. Smooth.
Smooth po, Doc. Smooth nga po. Kanina.
Anong difference niya sa voluntary?
Ang voluntary, Doc, is naka lang siya. Tawag dito. Para structure po. Tama po ba, structure?
Can you make an involuntary muscle move like this? Can you, let's say, a smooth muscle, no? Can you make it stop? Can you give an example of a smooth muscle? Okay, anyway, wala na dito yan. We would like to take that up next time, okay? The outer layer of connective tissue which surrounds skeletal muscle tissue is called? Hello?
Outer layer.
Yes.
Epimysium, Doc.
Which type of involuntary muscle has branched striated fibers?
At cardiac.
Number 7 is pointing to
Endomysium.
endomysium. Which type of muscle tissue is found in blood vessels?
Cardiac.
No.
Smooth, Doc.
So what type of muscle is smooth? Voluntary or involuntary?
Ang smooth po is involuntary.
So what's the difference? Skeletal. Ano niya? Di ba sabi mo skeletal is voluntary, smooth is involuntary. You cannot control, you cannot control it, right?
You cannot control the cardiac.
A muscle's extensibility is its ability to
A muscle extensibility, its ability to stretch without being damaged.
Okay, thank you very much, Ma'am Ami. Tawagan naman natin ulit si, andito na ba si Ma'am Joy? Biglang nawala. Di ba yan? Bakit nawawala?
Hindi ba isiha, Doc, eh?
Can I call? Yes. Yung mga hindi nag-ano, can you please mute your mics? Okay. Sir June, can you, since you got a perfect score, can we give it another try? Kasi nawala si Ma'am Joy.
Wait lang po, Doc, lumabas na po ako sandali. Wait lang po. May ano po.
Okay, how many main types of muscle tissue are there?
Wait lang po, Doc. Nasaan na po ba? Kasi lumabas po kasi ako. Nasaan na ba? Anong pista po ba, Doc? Lumabas lang po kasi ako sandali. Mayroon po kasi.
Oh, this is already Muscle anatomy, number 3, quiz 3.
Wait lang po muscle anatomy.
Okay, I'll give you time. Can I call Ma'am Lane Arandia once again? Ma'am Lane, are you there?
Yes, sir. Yes, Doc. Andito pa
Yeah,
rin.
you have to redeem yourself. Okay. How many types of muscle tissue are there?
3.
A muscle's elasticity is its ability to,
Return to its original length after contraction.
which number indicates the epimysium?
7.
No.
Epimysium.
Epimysium.
Number 2. Ay, hindi. Number 3.
Okay, number 3. An adductor is a skeletal muscle
Moves a limb towards the midline.
which number indicates an example of cardiac muscle?
12.
The outer layer of connective tissue which surrounds skeletal muscle tissue is called,
Epimysium.
which number indicates the main skeletal muscle?
11.
No,
Skeletal.
the main
Number-
skeletal muscle.
Number 2.
Okay. Which number indicates an example of skeletal muscle?
11.
No.
10.
Number 11 is pointing to an image of,
Number
Ano yan?
11. Smooth.
okay, muscle around the eye is called,
Oculi. Or orbicularis oculi.
the main muscle involved with chewing is,
Masseter.
which type of muscle is also known as voluntary muscle?
Skeletal.
Muscle's contractility is its ability to,
Contract forcefully when stimulated.
what is the name of the large muscle at the back of the calf?
Gastrocnemius.
Which of the following muscles acts as an antagonist to biceps brachii? So parang opposite siya.
Triceps brachii.
Okay, very good. Number 1 is pointing to,
Skull.
the patella is indicated by number.
14.
Number 8 is pointing to,
Mandible.
the pubis is indicated by number.
13.
The number 3 is pointing to,
Humerus.
the pelvic girdle is indicated by number.
11.
Number 2 is pointing to,
Clavicle.
the ribs are indicated by number.
10.
Number 5 is pointing to,
Ulna.
the sternum is indicated by number.
9.
Number 4 is pointing to,
Radius.
the tibia is indicated by number.
15.
Number 6 is pointing to,
Femur.
the fibula is indicated by number.
7.
Number 12 is pointing to,
Sacrum.
it's easier to study, skeletal or muscular? Hindi po na yung kasama.
Nahanap ko.
Okay, maraming salamat, Ma'am Lee.
Okay po. Salamat
Oh,
po, Doc.
okay. So keep studying. Thank you.
Thank
Now
you.
let's call on Ma'am Angelita Ramos. Good evening, Ma'am Angelita. I'm
Good
sure
evening, Doc.
you're ready. Okay, mabilis tayo ha. Number 12 indicate,
Naman masyado. Number 12 is ilium.
ischium is,
Ilium is 5.
what does number 1 indicate?
Number 1 is cranium.
Which number indicates the coccyx?
Coccyx is number 14.
Number 9 indicates,
Number 9 is scapula.
lumbar spine is number.
Number 4,
What does number 2 indicate?
cervical spine.
Number indicates the manubrium.
Number 8,
Number 7 indicates,
7, wait na, Doc. Patella,
carpals are number.
15.
I'm sorry. Carpals.
15, Doc.
No,
Ay, carpal, sorry, Doc. Number 13 sa kamay. Sorry, Doc.
it's okay. The costal cartilage is number
Costal cartilage, Doc.
costal.
10, number 10.
Okay. Number 3 indicates
Number 3 is thoracic lead.
what does number 15 indicate?
Number 15 is tarsals.
Which number indicates the phalanges?
Phalanges number 6.
Which number indicates typhoid process?
Typhoid is 11.
Number 5 indicates
Number 5, humerodial joint. Humerodial
which number
joint.
indicates the tibiofibular joint?
Tibio. Number 40, hindi. Number 15.
No.
Hindi, no. 14, Doc. Sorry.
Hmm.
Tibiofibular joint.
No.
Fibula. No,
Tibio-
Doc. No. Number 9. Sorry, Doc.
Oh,
Maliit na bone. Sorry.
yung sagot mo number 9 talaga. Okay. What does number
Yes,
3?
Doc. Number 3 is, wait lang, Doc. Number 3, temporomandibular joint. TMJ.
The sacroiliac joint is number
Sacral is, sacral. Nasa ano? Number 6.
no. Sacroiliac.
Iliac. Sorry, Doc. Iliac is
Iliac. Sacrum saka iliac.
12.
Okay.
Number 1, coronal suture.
What does number 14 indicate?
14.
Kanina.
Okay. Femoral joint.
Tibiofemoral joint. The talocrural joint is number talocrural joint is number
15, Doc.
okay.
Tama.
Number 4 indicates
Number 4 is glenohumeral joint.
good. Which number indicates a sternoclavicular joint?
Sternal. Okay. Clavicular. 10, Doc.
No, sternoclavicular. Sternum clavicle.
11, Doc.
What does number 10 indicate?
Number 10 is acromioclavicular joint.
Good. The acetabulofemoral joint is number acetabulofemoral joint. Ibig sabihin sa acetabulum. Acetabulofemoral joint is number
13.
very good. Number 7 indicates
7 is metacarpophalangeal joint
no.
or radiocarpal. Radiocarpal joint. Carpal is the wrist.
Okay. Radiocarpal joint. Radius carpus wrist. Which number indicates the squamosal suture?
Number 2,
Which number indicates the pubic symphysis?
UV. Number 6,
What does number 8 indicate?
is sa kamay ko. So, radiocarpal.
Kanina pa yun. Si number 7 yung radiocarpal joint, di ba? So, iba na yung si 8. Di ba?
Talok.
No, ang talo nasa paa.
Phalangeal joint. Phalangeal
Metacarpophalangeal joint.
joint. Yes, Doc.
Number
Phalanges.
1 indicates.
Number 1 is skull.
What is number 12 pointing to?
12 is ulna.
Number 13 indicates.
Femur.
The scapula is indicated by number.
9,
Number 6 indicates.
ilium.
What is number 7 pointing to?
7 is sacrum.
The fibula is indicated by number.
Fibula malito. 15.
Lumbar vertebrae. Anong number?
Number 5
Radius.
is number 11.
Rib cage.
Number 4,
Number 8. Ano yan?
cervical vertebrae.
Humerus. Anong number?
Number 3,
Thoracic vertebrae. Anong number?
number 10,
Number 2. Ano yan?
clavicle.
Number 14. Ano siya?
14 is tibia.
Congratulations, Ma'am Angelita. So I
Thank-
presume memorize mo na yung model, yung mannequin natin sa ano ha? Sa lamp. So when we
Yes,
see,
Doc.
we would like you
Thank
to
you, Doc.
ano, give us the names of the parts. So are you happy? You look happy, you look good.
Yes, Doc.
Yun, good. So
Yes,
ikaw
Doc, narinig niyo, Doc.
yung skeleton natin. Thank you very much and congratulations.
Yes.
Let's call on Sir
Thank
Victor.
you, Doc.
Thank you. Sir Victor, are you there?
Doc, nandito po.
Very good. Number 4. Ano po yan?
Humeroradial joint.
Good. Number 10.
Temporomandibular joint.
Tibiofibular joint. Anong number?
7.
Sacroiliac joint. Anong number?
Number 13.
Number 1. Ano siya?
Sagittal suture.
The tibiofemoral joint. Anong number?
15.
Number 8. Ano siya? Anong joint?
Palocrural joint.
Good. Number 11. Anong joint?
Acromioclavicular joint.
Good. The lambdoid suture is anong number?
9.
Which number indicates the glenohumeral joint?
Number 3.
What does number 2 indicate?
Atlantoaxial joint.
Good. Which number indicates a costovertebral joint?
Number 12.
Number 14 indicates?
Metacarpal phalangeal joint.
Or metacarpophalangeal joint. The pubic symphysis is what number?
6.
What does number 5 indicate?
Radiocarpal joint.
Radius, what number?
11.
Number 10.
The rib cage.
Number 8.
The fibula.
The clavicle, anong number?
9.
The femur, what number?
14.
Number 13, what is it?
Ilium.
Number, asan yung...
1.
Okay, number 1. Number 5,
The humerus.
scapula, anong number?
Number 3.
Lumbar vertebrae, anong number?
Number 6.
Number 7, ano siya? Saan sa dyan?
Sacrum. The
Number
sacrum.
2, ano siya?
Cervical vertebrae.
Number 15,
Tibia.
thoracic vertebrae, anong number?
4.
Anong number ang ulna?
Number 12.
Ano yung number 4?
Humeroradial joint.
Inferior tibialofibular joint is what number?
15.
Number 11.
Temporomandibular joint.
Which number indicates the atlantoaxial joint?
2.
What does number 10 indicate?
Coronal suture.
Number 6, ano siya? Anong joint?
Tibio-femoral joint.
Talocrural joint, anong number?
Number 8.
What does number 7 indicate?
Superior tibio-fibular joint.
Glenohumeral joint, anong number?
3.
Number 9, anong siya? Number 9.
Metatarsophalangeal joint.
Okay. The lambdoid suture is what number?
1.
Which number indicates the acetabulo-femoral joint?
13.
What does number 12 indicate?
Metacarpal phalangeal joint.
The radiocarpal joint is what number?
5.
Number 14 indicates.
Interphalangeal joint.
Okay. Congratulations po, Sir Victor. Are you happy?
Yes po. Yes, Doc. Salamat.
Would you be able to enumerate all the bones na ating... So ngayon nakikita niyo na kung gaano ka-importante yung mannequin. And thanks to Dr. Webb Lim for donating that. No? So laki utang na loob natin kay Dr. Webb. So don't forget to see him on Thursday for your practicum. Thank you so much and congratulations. Keep up the good work po, Sir Victor.
Salamat po.
Okay, let's call on Ma'am Shar. Ma'am Shar, good evening. Are you there? Still awake? Ma'am Shar? Ma'am Shar?
Yes, I'm here.
Okay.
Hello.
Good. So let's start.
Okay.
Number 8 is
The frontal bone.
which number is the manubrium?
11.
What is number 1?
Parietal bone.
The maxilla is what number?
9.
Number 2.
Islik.
Temporal bone.
Costal cartilage, what number?
14.
What is number 3?
Cervical vertebra.
What number?
12.
Number 4 is what?
The thoracic cage.
Which number is the mandible?
10.
Number 5. What is number 5?
Lumbar vertebrae.
Xiphoid process is what number?
15.
Number 6 is?
The sacrum.
Which number is the rib?
13.
What is number 7?
The coccyx.
Sternum is what number?
Where are we now? Sternum is number 12.
No,
15.
there's no number 2. Okay, 15.
What number?
1 is- Number 1 is?
Okay. There. Number 1 is the sternum.
No.
Sorry. Where are we now? Number 1. We're still done, no?
Iba
We're
na.
in side view na, right?
Oo,
The
side-
sternum is number 15.
There is no sternum here. What is number 1?
The backbone, the parietal
The parietal bone.
parietal bone.
Good. The mandible is what number?
The mandibles number 13.
What is number 20? Number 2, sorry.
Number 2, the occipital bone.
The cervical vertebrae, what number?
Number 4.
Which number indicates the maxilla?
Number 12.
Number 3 is pointing to?
To the atlas.
What is number 10?
The frontal bone.
Number 5 is?
The axis.
The thoracic vertebrae are what number?
Number 6.
Which number indicates the temporal bone?
Number 11.
What does number 7 indicate?
The lumbar vertebra.
Which number indicates the manubrium?
Number 14.
Number 8 is pointing to?
The sacrum.
The coccyx is number?
9.
Okay, now we go to the skull. What does number 7 indicate?
Temporal bone.
The mental foramen is indicated by number.
13.
Number 1 is,
The frontal bone.
which number is the occipital bone?
Number 8.
What does number 2 indicate?
The nasal bone.
Sphenoid bone is what number?
Number 9.
Number 3 is,
The zygomatic.
which
Bone.
number indicates the vomer?
Number 12.
What does number 4 indicate?
Maxilla.
The ethmoid bone is what number?
Number 10.
Number 5 is,
The mandible.
which number indicates the supraorbital foramen?
Number 14.
What does number 6 indicate?
The parietal bone.
Lacrimal bone is what number?
Number 15.
Number 11 is,
The infraorbital foramen.
congratulations, Ma'am Shar.
Thank you.
Excellent job. And I hope you're enjoying your time here. And when you visit LAMP, I'd like you to embrace the skeleton. We also have the skull there. So we expect you to really put into practice what you have actually mastered. Congratulations. Keep up the good work.
Thank you.
Thank you, Paul. Now let's call on Sir Michael. Sir Michael, are you still up?
Yes, Doc. Good evening.
Very easy to. Let's go to the spine. What is number 5?
The lumbar vertebra.
Good. How many lumbar vertebrae are there?
5, of course.
The cervical vertebrae are indicated by number.
3,
Number 10 indicates,
the fifth lumbar vertebra.
which number indicates the sacrum?
As number 6,
How many cervical vertebrae are there?
7,
What's the name of the first? Joke. Number 2 indicates.
indicate the axis.
Okay. Which number indicates the thoracic vertebrae?
Number 4,
How many vertebrae are fused together to form the sacrum?
2.
Are you sure? Bakit yung mga butas? Ilang butas ba yung nakikita mo? Okay.
Sorry, 7. Sorry.
Sa lab, na mo mabuti. It's not 7. That's too many.
5.
Hanapin mo yung butas ng ano. Say,
Okay. Aray!
done.
Okay. 5. Sorry, Doc. 10. 7 vertebra.
No, only 5.
Actually, I thought is number 9. Question number 9. Number 5, of course. 5.
Okay, number 8 indicates what?
7 cervical vertebra.
Which number indicates the coccyx?
Coccyx. Number 7. 7.
How many thoracic vertebrae are there?
1, 2, 3, 4, 5. Number 12. 12.
Number 1 indicates.
The atlas.
Why is it called the atlas?
So, di ko lumasa.
Binubuhat niya si skull. Diba?
Okay.
Ano niya yung globe? Kaya tinawag siya na atlas.
Okay.
Pagdating pupunta niyo sa lab, hanapin mo si Atlas. Number indicates the 12th thoracic vertebra.
9.
Okay. How many small vertebrae are usually fused together to form the coccyx?
4.
Okay. Number 3 indicates, sa teeth na tayo.
Yeah. First molar. That's first molar.
What does number 5 indicate?
First premolar.
Okay. The lateral incisor is indicated by number?
7.
The number 13 indicates?
The dentine.
Okay. The third molar is indicated by which number?
Third molar is number 1. Yeah, of course, number 1.
Lateral incisor is indicated by number?
Is in the center, so number 8 po.
Number 2 indicates?
The second molar.
What does number 4 indicate?
The second premolar.
The crown is indicated by which number?
Number 9,
What does number 10 indicate?
then is the neck.
Mhm.
The neck.
The pulp is indicated by number?
14,
Number 6 indicates
the canine.
the root is indicated by number.
Is number 11,
The nerve and blood vessels are within the.
pulse.
The enamel is indicated by number.
Number 12,
Wow, magiging dentista ka yata. Okay, let's go to the
wala akong ngipin ko eh. I have no
you. Which number indicates the patella?
the patella is number 2. Number 8,
Number 1 is pointing to what?
the clavicle.
The tarsals are number.
As the number 15,
What is number 2?
the scapula.
Which number indicates the phalanges?
Phalanges is in the little. Number 13,
Number 3 is pointing to.
the ilium
The metacarpals are number.
is the number 12.
Good. What is number 5?
Yeah. Is the radius.
No.
No.
Oh, no.
Oh. Kamali ako dun.
Saan ka ba kumukuha ng ng pulso?
Sa fibula.
Paano ba ang anatomical position?
So, anatomical position mo ba dito?
Di ba
Yeah,
nasa lateral? Pag nag-anatomical ka, lateral. So, the medial is ulna. Okay?
Wala.
The answer should be ulna.
Una. Sorry
Which
po, Doc.
indicates the ischium.
It's number 6.
Number 11 is pointing to.
The carpal.
The femur is number.
7.
Sino yung counterpart niya sa taas? Ni femur.
Sige. Ano ba sa taas?
Sinong counterpart niya sa upper extremity ni femur? Tandiyan lang, tingnan mo mabuti.
Tibia. Ito number 10 po, Doc eh.
Hindi,
Oo.
sabi natin, the femur, sabi mo number 7. Anong pangalan
Yes.
sa counterpart niya sa taas? Sa upper extremity?
Radius.
Anong radius?
Humerus or Michael.
The humerus. Tingnan mo mabuti number 10. Diba? What is number 14?
Fibula. Doon ako nagkamali.
Oh, mali talaga.
Yan yun. So, ito yung
Sino mas mas
radius. Oh.
sino mas payat, si tibia or si fibula? Sino mas
Fibula po.
payat? Joke. Sino mas payat, si tibia o si fibula?
Tibia?
No, si fibula. So si number 14, sino yan?
Ito na po si radius.
Hindi nasa paan na tayo. Nasa ano na tayo?
Sorry po.
Ano paan? Nasa leg. Okay.
Sorry.
Ano siya? Yung naka-point sa 14. Sino siya?
Radius.
Tibia. Ito ang clue natin. Tibia, taba. O, di ba? O, tapos yung si number 9, ano yan?
So, una si Fibula.
Fibula. Okay, sino counterpart ni tibia sa taas?
Tibia.
Okay, sino counterpart ni femur? Si humerus, di ba? O, may counterpart.
Humerus po yung sa taas.
Okay.
Tibia naman.
Sinong counterpart?
Si,
ni tibia?
si una. Oo.
Okay, si yung counterpart ni fibula,
Fibula.
si radius.
Radius.
Which number indicates the radius?
Radius. Nasaan? Sa number 4 po, Doc. Number 4, sorry.
Don't be confused. Number 9 is pointing to
9 is the fibula. Dito akong kamali na.
yes, fibula. The humerus number.
Number 10.
Okay, very good.
Sorry po.
One more. Ay, wala na. Iba na pala, sorry. Congratulations, Sir Mike.
Oo.
Don't be
Talagang nag-enjoy kami, Doc. Sorry.
Okay, buti naman. So when you go to you try to memorize all the parts of the skeleton there, okay?
Opo.
Oh, thank you very much. More power. Now let's call on Ma'am Cheryl Bahamundi. Ma'am Cheryl, good evening. Are you there?
Good evening.
Okay, you're ready. You sound very ready. Sige, para we can finish this. Okay. Number 4 is
The pubic symphysis.
very good. The radiocarpal joint is
Number 12.
what is number 5 pointing to?
The metacarpophalangeal joint.
Mhm. Which number is a tibiofibular joint?
Number 8.
Number 2 is
The humeradial joint.
the acromioclavicular joint is number.
9.
What is number 10 pointing to?
The sternoclavicular joint.
Which number is the sacroiliac joint?
Number 11.
Number 3 is
The acetabulofemoral joint.
the tibiofemoral joint is number.
It's number 7.
What is number 1?
The glenohumeral joint.
Which number is the talocrural joint?
Number 15.
Number 14 is
The patellofemoral joint.
a carpometacarpal joint is indicated by number.
13.
Okay, what is number 6 pointing to?
Number 6.
Yeah,
Oh, that's your PIP.
yeah, okay.
Interphalangeal joint.
Okay, interphalangeal joint, very good. The pisiform is indicated by number.
Oh, wait, let me see. Oh, I don't have the key.
Where is your key?
I lost my key.
Okay, you should have already learned that.
The pisiform should be number, let's see.
You lost your key? You should have
Yeah, I
also
lost
put
the
them in your
key.
head. Okay. This is not just answering, it's also about learning, remembering.
Yes.
Let's see. Okay.
The pisiform is okay. I'll just do this Owido. Number 2.
Good. Number 5 is
Number 5 should be the carpals.
the hamate is
The hamate. Oh my gosh, I'm doing Owido. The hamate is scurrilabous stripe positions that they can. Number 4.
number 12 is
Number 12 should be the trapezoid.
the capitate is number.
Scared lover stripe. They can. Number 13.
Number 1 is
Number 1. Scared. That's the lunate.
good. Radius is
Number 9.
number 14 is
That's your sesamoid bone.
very good. Metacarpals. Number
I'm lost. Metacarpals are number 6.
good. Number 7 is
Number 7 are your phalanges.
the ulna is what number?
That's number 8.
Number 10 is
Number 10. Number 10 should be the scaphoid.
number 9 is
Number 9 is the radius.
The trapezium is
Scared lover stripe positions. They can. Scared lover stripe position. Number. Scared lover stripe. Trachitrum is number 3.
no, there's no number
I-
3.
Oh yeah. Wait. Number 2.
No, no.
Wait. That's the stripe positions that they
Trapezium.
cannot have. Trapezium should be on the near the radius. Scared lovers. Is it?
No.
Yeah. It should be beside the it should be beside the scaphoid. So it should be number 1.
Number
Mm.
11.
Number 11.
You're confused. Sige,
Try-
mahaba pa to.
But-
Number 3
Okay. Wait, number 3 should be. I'm really lost right now. Number 3.
Sige.
Number nawala yung key.
And I usually would know.
That's your hamate.
No.
Number 3, scared lover stripe. Hamate.
You know how we used to have exams like this? The teacher would disassemble.
I lost my key.
Okay, what's that? Definitely it's not the hamate.
Number 3. But the PC form is attached to it.
Mm-hmm. So what is-
Trichitrum.
yes, trichitrum. Where is the cuboid?
My gosh, why did I lost my key? So the cuboid should be number.
So we announced
16.
sa foot na po ito.
Should be number 18.
Okay, good. Number 22.
Number 22 is the tarsals.
Navicular is
It should be beside the cuboid, so that should be 17.
okay, good. Number 17 is
The navicular.
okay, of course. Number 15 is
Number 15, where are you? That's the talus.
phalanges. Number
24.
16 is
16 should be the calcaneus.
number 19 is
19 is your first. No, that's the.
look at number 19. Does it look like it's the first?
No, it's the third.
Okay.
The lateral cuneiform.
The talus is what number?
That's number 15.
Number 18 is
That's your cuboid.
numbers. The second intermediate or the second cuneiform is what number?
Second cuneiform
It should be
is
beside the
number.
third.
It should be number number 20.
Very good. The tarsals.
I really lost my key. Okay, tarsals are number 23.
No,
No. 22.
22. There is no 23.
Yeah, 22.
Okay. Number 23 is
These are your metatarsals.
number 24.
Phalanges.
Number 21.
That's your first medial cuneiform.
Okay, might as well finish this because you lost your
Oh my God.
So
Where
it
are
will
they?
actually help
It
you
must be
remember
here
everything.
somewhere.
Okay,
must be
number
here somewhere.
5 is
Number 5 is pointing to your. Now I found my key. Those are the carpals.
very good. Number 23 is
23 is your metatarsals.
number 9 is
The radius.
cuboid is what number?
18.
Number 12 is
The trapezoid.
okay. Number 21 is
21 is your first medial cuneiform.
Number 7 is,
Phalanges.
number 16 is,
16. The calcaneus.
the metacarpals, what number?
Number 6.
The talus is, or
15.
talus. The ulna,
Number 8
the tarsals,
are number 22.
the hamate,
The hamate is number 4.
number 24,
24 are the phalanges.
the radius, what number?
Is number 9.
Okay. Label number 1 in the diagram indicates which part of the bone.
It's the, oh my gosh, where's my key? That's the metaphysis.
Good. Okay. The bone on the left in the image is?
That's the humerus. Oh wait, that's
The
the femur. Left.
Your
That's the
left.
femur. This
Okay.
is the femur.
Label number 5 in the diagram indicates the,
That's the diaphysis.
what do we mean by an articulation?
It's a connection or an area where bones contact each other.
Good. A crest on a bone is what?
A crest is a prominent ridge.
Good. What is label number 4 pointing to?
That's your proximal epiphysis.
What is a condyle?
A condyle is a large rounded articular process.
A canal is?
It's a long tunnel-like opening within a, oh wait, yeah, long
Within-
tunnel-like opening within a bone.
Label number 3 is what?
Number 3 is your distal epiphysis.
Good. Bone on the right in the image is?
Now this is your humerus.
An articular process is?
An articular is a projection that touches an adjacent bone.
What is label number 2 pointing to?
Number 2 is your medullary cavity.
A small projection or bump is known as?
A tuberosity.
No. Small
Bump.
projection. Or a
So
bump.
maybe an eminence.
Yes, eminence. What is the name for a projection near a condyle?
The epicondyle.
A small flattened articular surface is called?
What's my answer? A facet.
Okay, good. So, tapusin na natin. The
Ako pa rin, Doc.
indicated, tapusin na natin para we
Hindi
can,
tumitigil yung lamig ng kamay ko, Doc.
hindi ka pa nagkakamali masyado, hindi pa naman nagkakamali. Okay.
Hindi pa.
Anong number yan? Ang diaphysis?
Quiz ano na ba tayo, Doc? Quiz
Quiz
2. Ba't nawawala yung mga notes ko? Number 5
mo
po.
na lahat na.
Number 5.
Okay.
Nawawala yung mga keto correction.
Ano ba yan? Okay. Napadilagay. Okay, sige, go. Number?
This is the articular process. Number 2. Question 2, articular process. That's number 5.
Okay. A projection that, yeah, contacts an adjacent bone is the articular process.
Articular
Very good.
process.
Adjacent bones contact each other at?
An articulation.
In the diagram, the metaphysis is what number?
1.
A long tunnel-like passage is called?
A canal.
What do we call a large, rounded articular process?
It's the condyle.
Which label indicates the medullary cavity?
Number 2.
An eminence is what?
What number are we?
Number 8.
Number 8 is a fairly
No.
no, a small projection or bump.
Okay. The term epicondyle refers to,
A projection near the condyle.
in the diagram, the distal epiphysis is indicated by number.
Number 3,
A prominent bony ridge is called.
a crest.
A facet pala, is a small, is what?
You answered it. A small flattened
flattened.
articular surface.
Which label in the diagram indicates the proximal epiphysis?
It's number 4.
What is a foramen? Or a
It's
foramen?
an opening within a bone.
Okay. What is a fossa?
It's a wide and shallow depression.
Okay, let us have this done with. The term fovea refers to.
A small pit or depression.
A labyrinth is.
A cavity within a bone.
Good. The line on a bone is.
A long, thin projection.
What is a malleolus?
It's a protuberance of the bone found in the ankle.
The term meatus refers to.
A short canal that is open only at one end.
A large projection or bump is known as.
The
Large.
I think it's a process.
So what do you call the small projection or bump?
An eminence.
Okay, very good. A branch from a bone is called.
The ramus.
A cavity within a cranial bone is.
The sinus.
A long, thin projection on the bone is sometimes called.
A spine.
The articulation between two cranial bones is called.
A suture.
A trochanter is.
Where are we? Number
Where do
11.
you find a trochanter?
A tuberosity on the femur.
Good. The term tubercle refers to.
Tubercle is a small, rough projection or bump.
How is it different from the eminence?
Probably the eminence is smooth.
Yes, okay, very good. What is a tuberosity?
It's a rough projection or a bump.
Tubercle, okay. Diaphysis is.
The shaft of a long bone.
Finally, we have the last question for. Ay, meron pa pala isa. Oh my God. Okay.
Ako pa
What is
rin?
epiphysis?
Iba na naman, Doc.
Last na to, last na. The epiphysis is.
Nawala na naman yung ano mo
Sabi ko
dito
pala to.
connection.
Okay.
Mano-mano na lang, Doc. Where are we?
What is an
Question
epiphysis?
Quiz 4? Ay. Quiz 4.
What is the
Epiphysis.
epiphysis? Yeah.
Wait, Doc. Let me. Oh, okay. An epiphysis is the end of a long bone.
Okay, very good. Would you like to continue?
My heart is gonna give up soon.
Oh, sige, it's okay. Sige, baka mamaya atakihin pa. Tapos na talaga
Ano naman
tayo.
to?
Thank you very
Haba
much.
na to. Thank you,
Thank
Doc.
you very much. Mom Cheryl. Okay, thank you. I hope
you
you,
po.
you had fun. So next time, even if you lose your código, we presume na alam nyo na po ito. Okay. Let's call on, who did I not call? Hindi ba yung wala kanina? Sino ba yung, okay. Shall I call back? Sir June, would you like to volunteer? June Azariel? Quiz 4 and 5.
Try, Doc.
Okay.
Okay, Doc.
A small pit found on the head of a bone is called?
How do you pronounce it? Foria?
Fovea. I think magpapasalamin ka na. Walang R dyan. Fovea.
Doc, nagkakapobia na ako.
A cavity within a bone is sometimes called a
How does labyrinth?
labyrinth. A long thin projection on the bone is sometimes called a
Line?
Which of the following is a protuberance in the ankle? Parating mention yan when you locate something sa ankle.
The
Okay. I presume you're very familiar with the medial and the lateral malleoli, the plural. A short canal in the bone open at only one end is called
meatus.
meatus. Okay. A process is
A fairly large bony projection.
what is a ramus or a ramus?
And wait lang, Doc. An arm like a branch of bone.
Very good. The term sinus refers to
A cavity within a cranial bone.
a spine on a bone is what?
A long thin projection or bump.
What is a suture?
An articulation between the cranial bones.
An epiphyseal plate is what?
Area of hyaline cartilage between the epiphysis, metaphysis.
The head of a bone is?
What number, Doc? At 12. A proximal articular end.
What is a metaphysis?
The area of a long bone between the epiphysis and the diaphysis.
The neck of a bone is?
An area between the head and the
The shaft.
Shaft.
Okay. An opening through a bone is known as?
Forearm.
Yes, forearm. Kailangan mo na siguro ng salamin. That's foramen or foramen.
Foramen.
Foramen. The last one. A broad shallow depression is called a?
Fossa.
So anong pagkakaiba niya sa fovea?
Fovea and fossa. Fossa is
Yeah.
a fossa, right?
Ito mas malawak, broad, fossa.
Yes.
No? Yung isa Which of the following is a tuberosity on the femur?
Wait, Doc. Trochanter.
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 Okay. A smaller projection than a tuberosity is sometimes called a?
Tubercle.
A rough projection or bump is known as?
Tuberosity.
Very good. The main shaft of a long bone is called the?
Diaphysis.
The end region of a long bone is known as the?
Epiphysis.
The area of hyaline cartilage between the epiphysis and metaphysis is called the?
Epiphyseal plate.
Okay.
Right?
The proximal articular end of a long bone is known as the?
Head.
The area of a long bone between the epiphysis and the diaphysis is called the?
Epiphyseal plate.
No. Between the epiphysis and the diaphysis.
The metaphysis.
Metaphysis. The area between the head and shaft of a long bone is called the?
Neck.
Very good. What do we mean by articulation?
An area where bone contact each other.
A canal is?
A long tunnel-like opening with a bone.
A prominent bony ridge is called a?
Crease.
An eminence is?
A very long projection.
No. Maliit lang siya. Small
a long
projection
thin-
or bump. Eminence. Maliit lang. The term epicondyle refers to?
Projection here to the condyle.
Okay.
Condyle.
Thank you very much. And I hope you all had fun. We're not done yet. We're going to the Luo-Connecting points.
Pas na ako dyan.
Sige. Oo, kasi inulit-ulit ka na. Sige, I'll call somebody else. Okay, let's call on Ma'am Lynn. Ma'am Lynn, good evening.
Good evening, Doc.
Yeah. Can you tell us or can you describe the two possible meanings of the term Luo or connecting channel?
The first one is to connect the connecting channel itself, which departs from the connecting point and travels upwards. And the second is the whole area of the body that lies between the main channel and the skin.
Very good. I hope you all got that. So You have the reference. So that's what we mean by the. So to repeat, it's actually so when we talk about the Luo channel or the connecting channel, this is the pathway of the chi that departs from each connecting point. So ito yung parang naghihiwalay from the main, no? And it is also the area of the body that lies between the main channel and the skin. Okay, to which pathology are the connecting channels particularly susceptible? Or to rephrase it, like when do you use the connecting channels or the luo?
The connecting channels are susceptible usually to stagnation of qi and blood.
Okay, so when there is pain, no? Blood and chi stagnation. Okay. Can you mention, of course, meron tayong kanya-kanyang luo connecting points, no? Can you mention additional luo connecting points?
Spleen 21.
Very good, yeah. What else?
Stomach 18.
Mm-hmm. Okay, give it another try. What about the point in the Du channel in the governing vessel?
The governing vessel, do 1.
Du 1, very good. What about sa Ren channel?
Then 15.
Very good. Okay, what are the actions of the Luo?
Actions of the Luo channel. Treats the channel which it belongs, and also their interiorly exteriorly related channel.
Yes. So you need to know the interiorly exteriorly related channel or the Zhang.
Use the source point and
Yeah.
the loop points as host and guest.
Okay. And it
It
also,
can also be used for according to full and empty symptomatology
okay.
and according to their energetic layers to affect superficial layers in the channel problems. For stagnation of chi and stasis of blood.
Yeah, we also use that for psycho-emotional disorders. Okay.
And also to drain or tonify the connecting channels according to the manifestation on the skin.
Okay.
And
Good. I
according
hope
to their
everybody got
specific
that.
action.
So what are the indications of the lung luo? By the way, what is the lung connecting the luo of the lung?
Lung boost immune system for one-sided migraine, for asthma.
So
It's common cold for neck issues and others.
yeah, so what's the luo connecting point? The luo of
Lung 7.
Okay, very good. What about for large intestine? What's the luo point?
LI6.
Very good. So
For
when
nosebleed, for
where
upper
is it
body
indicated?
edema, for urinary, for sore throat.
Okay. And also when there is in cases of wind water, like acute edema from external wind that will disrupt the function of the lungs. And then what about for the stomach? What's the Luo connecting point?
Stomach 40.
Very good. This is very popular, diba? Like, can you name the indications of stomach 40?
Stomach 40 is the best point for phlegm. It's for coughing, for asthma, for depression, anxiety, vertigo. It also be used for dizziness, obesity, blood sugar imbalance, manic behavior.
Yeah, manic behavior. That's why it's very good for psycho-emotional disorders. What about for the spleen, Luo? What's the spleen Luo connecting point?
It's spleen 4.
Okay,
It's for
what does it do?
diarrhea, stomach pain, menstrual issues, nausea, vomiting, anxiety.
Okay, very good. What about the small intestine? What's the Luo connecting point?
SI7.
Okay, very good.
It's
What does
also
it
for
do?
anxiety, for neck pain, for febrile diseases, for dizziness, for occipital headache. It's also used for mania.
Okay, so basically, when you talk about the small intestine Luo connecting point, it actually impacts its interiorly exteriorly related channel, which is the heart, no? So we use this when there is agitation because it can calm the spirit of the ba. So it's very good for psycho-emotional disorders like mania, depression, fear and fright. Yeah. What about for the Luo-Connecting point of the bladder?
Bladder 58.
Very good. So what does it do? Like when do you
It's
use
for
it?
low back pain, for nasal congestion, for hemorrhoids, for cough pain, for headache, for nosebleeds.
Would you use it on somebody who has cold in the lower part of the body? Would you find bladder 58 useful? Diba sometimes malamig yung paa, so we would want to use bladder 58 because that is a sign that the kidney is very deficient, kidney yang deficient. So we use bladder 58. Okay, good. What about the very popular Luo-Connecting point of the pericardium?
Pericardium 6.
Okay, so can you tell us more about it, the indications?
Pericardium 6 is the command point of the heart in chest and stomach. So it's good for chest pain, for belching, acid reflux, for anxiety, for nausea and vomiting. It could also be used for neck ache and irritability.
Okay, so we have pericardium 6. What about the gallbladder? This is actually my favorite for...
Gallbladder 37.
Okay. Is everyone familiar with the floaters? No, especially when we lock sleep, like all we had to do, all we do is read.
Effective talaga to, Doc. Sinubukan ko na to.
As in, because I have see Dr. Ryan, he's not here anymore. He must be busy. He had these floaters. He wanted it sana kasi it's been like bothering him. Kasi he does a lot of reading. So usually he's up mga alauna, alas dos, alas tres sometimes, no? Because iba nga ang time sa States. So most of the time he lacks sleep. So he would make bawi. And he has been complaining of floaters. So in the webinar earlier, so ngayon ko lang naalala, GB37, can you tell us more about it, ma'am? So we use it for treatment of eye disorders.
For blurred vision, for eye pain, for night blindness.
And also floaters.
Could also be used for knee pain.
Effective talaga siya, diba?
Breast distension.
Okay. Gallbladder 37, remember that. Yeah. What about the heart Luo-Connecting point?
The heart Luo-Connecting point is heart 5.
Okay, can you tell us more about it? Like
for dizziness, stuttering speech, blurred vision also, urine retention, for loss of voice, and for palpitation.
Speech issues, diba, palpitations. What about the kidney? What's the kidney Luo-Connecting point?
Kidney 4.
Okay, so usually when you talk about indications for the kidney luo, we would always connect it with the heart, diba? Kasi it should communicate with the heart. So if there is a disconnect, so you would see palpitations, diba? Restlessness, the patient, and sometimes may dementia, yun, propensity to anger. Can you tell us more about it, Ma'am Lynn?
So before could be used for phobia, fear, wheezing, palpitation.
Yes.
Low back stiffness, yawning.
Okay.
Menstrual issues, painful urination.
And what about the liver Luo-Connecting point?
Liver Luo-Connecting point is liver 5.
Liver 5, okay. So what are the indications of liver 5?
It's for irregular menses, for bladder infections, for genital issues like herpes or genital itching.
Yeah. And what about the Luo-Connecting point of the REN or the conception vessel? You mentioned earlier it was REN 15, diba? So like what?
For depression, mania, nausea, chest pain, acid reflux, could also be used for epilepsy.
Okay, very good. And what about the governing vessel or the Du meridian?
It's do one. It's
Okay.
for low back pain, constipation, hemorrhoids, rectal prolapse, and bloody diarrhea.
Okay, very good. And you mentioned about the extra spleen luo.
Spleen 21.
We
It's
call it
the
extra
spleen
because we have
luo.
the Luo-Connecting point of the spleen, diba? So there's another one, we have the extra, which is very, very effective for people with,
It's for asthma, fullness, and pain in the chest, and hypochondriac region. It's for general pain. It's also for tiredness of the limbs.
okay, very good. Thank you. Thank you very much, Ma'am Lynn. I hope everyone got that. Okay. Alam ko masyadong puro anatomy yung nasa utak nyo, but konting ano na lang, konting kapit na lang. I did not imagine we could finish this. I think this is the last one. I'd like to thank you very much, Ma'am Lynn. I'd like to call on Dr. Sam. Dr. Sam, good evening po.
Oh, yes, Doc. Good evening.
Good evening. And you sound very prepared and you
No,
sound
Doc.
tired. And
Actually, I was overwhelmed with the anatomy, and I failed to study this one, the last one.
It's okay. We
Yeah.
know how very busy you are, pero you know what? Honestly, I'm so impressed with your performance. I think some were able, even though they forgot or they lost their código, they were still able to answer, no? So I hope we will continue studying, and I know that it's quite boring to study all this. I hope you're enjoying this, and don't look at the number of pages. They're just pages, no? What is important is at least we can already tell that you're getting you're familiarizing yourself with all the anatomical parts, and that's what's important. Okay. So, Dr. Sam, do you still have the energy for the last topic? We're going to talk about the host and guest protocol, no? So this is like when you talk about the host, we're actually talking about the yuan source point of the affected meridian. So this is after assessing the patient and somehow you will determine what point to use. So this is one protocol which a lot of people find effective. And then you combine it with the Luo-Connecting point, that's the guest, the Luo-Connecting point of its exteriorly coupled channel. So can you tell us more about it, Dr. Sam? Would you like to add something else?
Actually, Doc, I'm not really sure. Yeah, I miss a lot of these things for how many weeks? Yeah.
Okay. So anyway, sige lang. No problem. So, okay, this is one example, no? Somebody messaged me last time. I think it was Sir Elvis. Imagine na, Sabado ba yun or Sunday? I cannot remember. He was already answering this part. So that means tapos na niya yung una. So ganoon dapat, ha? Okay. So he asked me, ano ba itong LI4 and LAM7? Which one? So nobody asked Yalam. So ganito po yan. The first point that we mentioned should be the host. Diba? Una man talaga yung host. So this is supposed to be the yuan source point. So we're talking about an LI imbalance. And so alam naman natin when we use LI4, diba? It is called the great detoxifier. Do you remember, Sir June? Diba, Dr. Sam, great detoxifier. So we would also be looking at its Luo-Connecting, no? Which is lung 7. So we use lung 7 to assist in expelling the pathogen, okay? And also to be able to restore the descending and disseminating functions of the lung. Okay na, Dr. Sam, mukhang pagod yung boses niyo. It's okay. Just
Okay.
try to, okay, it's up for you to Google or to really go into your, what I'm showing here kasi, like, these are the usual combinations that you get, especially when you treat external wind invasions, no? So LI4, alam naman natin, we want to expel the pathogen, and we all know that LI4 is a great detoxifier, and you also need to use the guest, no? So as Ma'am Lynn mentioned earlier, the lung 7 is actually the point in which the lung channel departs from its primary channel. So this is the so ibig sabihin, ang impact nito is sa LI pa rin. So it's basically assisting in expelling the pathogen. And we all know that lung 7 is so effective to actually restore the descending and disseminating functions of the lung. Okay, so I hope you can take this down. Lalo na ngayon, ang daming nagkakaroon ng wind heat invasion or even wind cold invasion, no? Okay. Another combination would be lung 9 and LI6. Okay. Sir June, ano po yung lung 9? This is the yuan source point ng lung, right? So, it always helps to really remember sino yung kanyang katambal na Luo-Connecting. And this was mentioned earlier, it's LI6. Okay? Okay. So LI6, so it's supposed to be helping out. It will open the water passages. And we usually use this when nagkakaroon ng like, di ba there are times na nagkakaroon ng edema yung mukha, sa upper or sa upper body, nagsuswell yung kamay, especially when pag na-expose ka sa wind water. Di ba, umuulan, tapos mahina pa yung yung lungs mo, ganon, no? So the LI6 can actually help in trying to get rid also of the pathogenic wind, because the pathogenic wind, especially if maulan, this will disrupt the function of the lung, so that will result in acute edema. Okay?
Doc, I got a question. Is it also what I read regarding LI6 is also good for edema?
Yes.
For like water retention?
Yes. When the water retention is brought about by when the descending function of the lung is disrupted. So nangyayari, you'll have swelling of the upper part of the body. Minsan it's the muka that gets swollen, diba? Or sometimes bakit parang nagmamanas yung kamay mo. So yeah, LI6. So we always think of the lung. Okay, so LI6 is the Luo-Connecting point of the large intestine. And so this actually connects with the lung 9. Lung 9 is the yuan source point, remember? Any other question? So the root of the pattern here is actually lung deficiency. So when we combine it with lung 9, LI6, we will not treat only the root of the problem, which is the weak lung. Kasi kung hindi naman weak yung lung mo, hindi ka magkakaroon ng edema. So the branch or the manifestation is actually the edema. Okay? So I hope that helps. So meron na tayong dalawang combination, LI4 and lung 7. Then we also have, like, when you have edema, you will think of combining lung 9 with LI6. Another one, I'm sure you're very familiar with this, especially pag ang daming phlegm. Okay? So alam naman natin, pag maraming phlegm, it's usually due to a very weak spleen, no? Or you may have spleen Qi deficiency, spleen Yang deficiency, pag may cold, no? And so spleen 3 is the yuan source point of the spleen. And we all know that the manifestation would be phlegm. So we try to, the root cause is a very weak spleen. Hindi ka naman magkakaroon ng excessive phlegm pag hindi. So yun. So we use the stomach 40 to resolve the phlegm. In fact, this is our favorite to resolve the phlegm. So every time you use stomach 40, pag makikita kang phlegm talaga, like when you look at the tongue, it's so rough and swollen, and it's just rough, no? Maraming phlegm. And the patient would feel heavy, ganon. So you have to treat the yuan source, spleen 3 combined with stomach 40. Then another one. Yes.
Sorry. Doc, I tried to use the stomach 40 and spleen 3. If there will be we have some case like manic depression.
Yeah.
So yeah, we know for a fact that the cause of this manic depression, bipolar disorder is also phlegm.
Yes, phlegm misting the mind.
Yeah. Okay.
Wow. And then you found it effective?
Yes. Yes, Doc.
Amazing. Kaya nga kanina, if you were all listening, di ba? That's the good thing about Luo-Connecting. We can also treat psycho-emotional disorders. So it took one very intelligent practitioner like Dr. Sam to actually realize that, no? Stomach 40. To be honest, every time I see someone with mental issues, I would never think of stomach 40 right away. Siguro, what Dr. Sam did was to actually analyze. Or siguro nakita niya may phlegm talaga based on his tongue diagnosis, and probably the pulse is very slippery, no? And the patient would probably be, sometimes they would talk by themselves. Yun. Can you tell us more about it, Dr. Sam?
Yes, Doc. Actually, this is a kind of a bipolar disorder. It's just sometimes happy siya, napakasaya, tumatawa-tawa. Tapos minsan, nagwawala.
Okay.
So then we check on the pulse and the tongue. Yeah, that's correct. The pulse actually
Very slippery.
yeah, very slippery, and the tongue is yellow and very rough.
Okay.
And
So how did you know that it really helped? Of course, we would see improvement sa pasyente. Like, what makes you think na nag-improve talaga? Did you monitor the tongue again on the...
yeah, yes, Doc. Actually, nagre-relax yung patient, and then hindi nagaano, sabi ng according to ito mga kapatid, di din daw ganon siya ka talagang
Wow,
meron
grabe.
improvement sa health.
O, diba? O, pakinggan nyo yan, ha? Alam ko, some of us may already have issues. May manonood
Yes.
na observe. Pero I'm not saying no. Pero sige lang, tingnan natin yung mga dila natin. Baka nakaka-relate tayo. Especially when you feel... Thank you so much, Dr. Sam. It's good to know na talagang mayroon nakaka-relate. So yung mga yung batch 2, medyo kalma-kalma lang muna. Just memorize muna the points. Okay, the next pairing would be heart 7 with SI7. Okay, alam naman natin na interiorly, exteriorly related yung dalawa. And we all know that heart 7 is a very popular point. We use it to calm the mind or calm the spirit. And this is called the yuan source point, right, of the heart. And so yung ganyang Luo-Connecting point ng SI is SI7. So SI7, just like any other Luo-Connecting channel, Luo-Connecting points, is very good on treating psycho-emotional disorders. So Dr. Sam was right earlier when he was like, of course, we all know that pag maraming phlegm, eventually the heart could be affected, right? So you can have also this protocol. We combine heart 7 with SI7. So this is very good kasi nakakakalma. So we usually use this for patients na naghahanap na ng matataas na like kumakanta na, naguhubad na, yung mga ganon. So, yeah. Okay, another one. I hope you still have energy. Okay, kidney 3 with bladder 58. So Ma'am Lynn mentioned bladder 58 earlier. And why do we use this pag medyo malamig yung paa? I noticed this, like some patients, especially pag hindi na masyadong bata, when they have bladder issues, no? Like ihi ng ihi, pag pinag-take mo yung paa, yung lower extremities, medyo malamig. So you would be looking at a kidney deficiency, no? So kidney 3, if you remember, is the yuan source point of the kidney. Then we combine it with the Luo-Connecting point in the bladder, which is bladder 58. So using kidney 3, this will benefit the yin of the kidneys below. Kasi diba, like may mga tao, malamig yung paa, pero masyadong agitated, hindi makatulog. Have you experienced that? So may yang siya, tapos may yin. So, syempre pag kulang ka ng yin, nagkakaroon ka ng heat. You get what I mean? So kidney 3, now bladder 58 can lower excessive yang. Syempre pag sobra yung yang, tumatagos papunta sa ulo yan. So I hope this can help. Kidney 3 combined with the bladder 58. And another one, which is very popular, this is also a favorite of Ma'am Lynn, and she was saying earlier, it really benefits the eyes, no? So when we talk about the eyes, we're talking about the liver, right? So, yung mga may eye disorders, mga blurring of vision, yung ano ba to? Floaters, familiar
Yeah,
with?
floaters.
Yeah.
I float.
Yes. Do you want to say anything? I'm sure nag-enjoy na si ano. Malapit na tayo matapos talaga. So, combination liver 3 with gallbladder 37. Because liver 3 we all know is the yuan source point of the liver, and you have to be very careful when you needle it. It's a bit masakit, but there's a technique, no? There's a technique. If I were you, you use the tube para hindi masyadong masakit. Use the probe so that you can locate it very well para mas masakit pa yung probe kaysa sa pagtusok mo. Okay. And then GB37, try to locate where it is. No? Memorize ni Ma'am Lin yan. So 5 soon, diba? Superior to your lateral malleolus. Yeah. So tibia. Okay. And lastly, okay, ito naman, hindi, okay, this is a combination of the yuan source and so it's lung 7 and lung 9. Now, there are people na matagal na masyado yung cough. So hindi na po ito guest host. A host guest. For those with chronic cough, alam niyo naman ngayon, pag may cough tayo na medyo mag-a-avoid sa atin yung mga tao, you try combining lung 7 with lung 9. Okay? We all know that lung 9 is the yuan source point and lung 7 can help descend the qi. Okay? Nako. Finally, we're good. So, maraming don't leave yet. We're going to talk offline. And thank you everyone for joining. Congratulations to all. And I know you're so pagod and you're all excited for the next one. Thank you very much.